and they will put here subject died in or during or subject passed away, or maybe they'll start writing. I mean, they can put initials, which is what you want, and then they'll put the country and sex of the patient, when the patient reacted, and then they would just say 38-year-old male subject experienced rash and breath, hypersensitivity. I'm writing this for a reason. I'll tell you why. So this is what they're saying. The subject came with rash and shortness of breath, diagnosis hypersensitivity reaction to COVID vaccine. The patient was admitted in the hospital. The patient passed away. So this is the narrative they have given you. This is the story they have given you. This is the clinical scenario or the narrative they have given you. And they said the patient came in hospitalized, had life-threatening a condition, and the patient passed away. So when you are really doing seriousness assessment, you are making sure that, oh, this is they have already checked off these fields. It's not something new. You're not trying to diagnose something. If you are medical doctors, don't try to diagnose in pharmacovigilance. You're too far from the patient to do it. So you're basically harming a patient if you're diagnosing something. You can query, you can ask the site, like if you can ask the reporter, is this something that happened with the patient? You can always ask, but you can't just diagnose something just by looking at an adverse event report form. So here the patient died, the patient was hospitalized, the patient had life-threatening. So what you're trying to do is whatever they have given you, you want to make sure this stays the same when you are doing your data entry or when you are entering the case in the Argus database or any safety database. So what you're trying to do is are this consistent with what happened with the patient? Now here, if I read this thing, I would say, yeah, this is all true. Now the patient had rash, hypersensitivity, admitted in the hospital, so this is right. And the patient passed away. Probably the patient had some life-threatening condition like hypersensitivity and the patient passed away. Now let us say, for example, the patient admitted in the hospital. So they said the patient admitted in the hospital with rash, shortness of breath, hypersensitivity to COVID vaccine. Subject recovering from the condition. Let us say, I'm just trying to make the story easier for you. So this is what they said. Now you get this adverse event report form saying that the patient was hospitalized for COVID vaccine hypersensitivity. The patient was treated, obviously, and the patient was recovering. But when you see the seriousness criteria or the seriousness, they checked off not only hospitalization, but they checked off death of the patient and life-threatening. This is not coherent. This is not in line with what is given here. Even if you don't have this doesn't say anywhere in the narrative that the patient died. So here you have to understand the story that they have given you and the narrative they have given you doesn't match, or when you cross check, it doesn't match with what is given here. So you may have to make sure, first of all, it is better to make this a 7-day report, because all death cases or death